Okay, in the continuity of the drug series, let's talk about the Dapsone today. Dapsone is a very important drug and it's one of the favorite drugs of the examiners. So, talking about the Dapsone, Dapsone is nothing but the sulfone. It belongs to the group of drugs that is called sulfone. The other drugs that are included in this group is your sulfapyridine and sulfamethoxypyridazine. So, these are two important drugs for the sulfone group. For the dapsone, it is very important that what is the mechanism of action of dapsone. Many examiners ask one or two or three mechanisms. So it is important to remember that the dapsone is anti-infective, anti-epileptic, and anti-inflammatory drug. Anti-infective is very important because most of the time it is used for the leprosy, in the treatment of leprosy, specifically for the leper reactions, and for the prophylaxis of the malaria and pneumocystis pneumonia. In the anti-inflammatory dermatological point of view, the anti-inflammatory mechanism of action is more important because it is FDA approved for the dermatitis herpetiformis. Just remember D for dapsone, D for dermatitis herpetiformis. So the only FDA approved dermatological condition of dapsone is just two conditions, which is DH and leprosy. So it is important to remember. So far we have discussed the two important points: the mechanism of action of dapsone and your FDA approved indications of dapsone. Other indications, off-label indication, there are many uses. It can be uses in the pemphigus, pemphigoid, in the connective tissue diseases like LE, dermatomyositis, in all the neutrophilic disorders, in the form of pyoderma gangrenosum, sweet syndrome, and vasculitis. So these are all the off-label uses of dapsone. It can be used in a variety of conditions, even psoriasis. So a next important viva question is, what is the other name for dapsone? So the other name for dapsone, this is a very favorite question for the examiners, that the other name for dapsone is basically diamino diphenyl sulfone. This is a very important name to remember. By the name diamino diphenyl sulfone, it is just evident that it is nothing but a sulfur group that is connected or surrounded by the two aromatic amine rings. This is an additional information, no need to worry about it. Just remember the name diamino diphenyl sulfone. What is the dose of dapsone? It is available in two dual dose, in the form of 50 milligram tablet and 100 milligram tablet. But now it is also available topically in the form of Dasone or Dapsone, a 5% gel which is used in the acne. So it is an important use as well. Now comes the pharmacokinetics. Just remember this line: Dapsone loves desi ghee, because it's a lipid soluble drug. It's not soluble in water, so it's a lipid soluble drug. And whenever you take the Dapsone by mouth, it is readily absorbed from the GIT, and the peak concentration reaches in about 2 to 6 hours. So in Dapsone, you just focus that there is a too much D's. There is a dual dose, 50 and 100 milligram diamino diphenyl sulfone, its name, and the its metabolic pathway is also dual. So when it reaches the liver, it follows the pathway of acetylation or either hydroxylation. Acetylation is your A1 pathway. It produces your non-toxic metabolites, while your hydroxylation is your hazardous pathway. It produces your toxic metabolites. So this is important for the dapsone metabolites. Acetylation produces acetyl dapsone in the form of monoacetyl dapsone and diacetyl dapsone, while hydroxylation produces hydroxylamine, which is definitely toxic. So this was all about the pharmacokinetics. Talking about the pharmacodynamics, it's affects the folic acid metabolic pathway. How? Because it inhibits the dihydrofolate reductase of the bacteria, so it is important. Now another important pharmacodynamic is that we have just discussed that dapsone is used in a variety of neutrophilic disorders. So because it inhibits neutrophils at each and every point of its metabolic pathway. It inhibits its recruitment, its lysosome, its lysosomal enzymes. It suppresses the integrin mediated adhesion and recruitment and attachment also. So by inhibiting the interleukin 8, even the chemokine that is released by the neutrophil is inhibited by the dapsone. Interleukin 8 is also inhibited by the dapsone. So it is going to block the respiratory burst of the neutrophil in each and every way. So pharmacogenetics is basically, the toxic metabolite of dapsone, which was hydroxylamine. It has a strong oxidizing property. So the individuals who are G6PD deficiency are more prone to the oxidative stress of the produced by the dapsone. What happens is, in your body, your normal metabolic pathway NADPH is produced. NADPH is very important for the reduced glutathione maintenance, that is a scavenger of the free radicals. In the absence of the NADPH, which is definitely in the individuals who are G6PD deficient, the reduced glutathione is not available, and your cells are very much prone to the oxidative stress produced by the oxidative radicals. free radicals, and these cells are vulnerable to the damage. And the more important cells that are affected by this oxidative stress is your erythrocytes is going to be damaged, and there is going to be phagocytosis, and the ferricine is reduced, is basically oxidized, not reduced, it's oxidized to the ferric state. So see, you can just remember C for caution. So ferric needs just a little bit of more caution. It's Fe3 plus. It's a oxidized form of iron, and it produces, when it is incorporated with the heme, it produces methemoglobinemia. And methemoglobin is just waste of your energy. It has decreased oxygen carrying capacity. So the important side effect of the dapsone is your methemoglobinemia. Now, nothing to worry about the side effects of the Dapsone, because we have just an easy mnemonic, Dapsone. Just remember, all the side effects of Dapsone is in its name. D for Dapsone hypersensitivity syndrome, A for agranulocytosis, P for peripheral neuropathy, S for again sensitivity syndrome, O for ocular, N for nausea, and E for erythroderma and exfoliation. So these are all the side effects of Dapsone. We are going to discuss it one by one. What is basically methemoglobinemia? For methemoglobinemia, this is an important table. At the different concentration of the methemoglobin, the patient is going to have the different symptoms. So you should be aware of these symptoms a little bit to have an idea how much methemoglobin is produced in the body. So at the 0 to 3%, there is going to be no symptom. This is important, that the 3% is a safe range. There is going to be no symptom. But above the 3%, there is 10 to 20%, there is going to be cyanosis, and there is going to be chocolate brown blood, because methemoglobin is not able to carry the oxygen, and there is going to be cyanosis of the body. 20 to 50%, there is going to be neurological symptom in the form of dizziness. There is going to be tachycardia, in decreased oxygen carrying capacity, and there is going to be dyspnea. So the patient is having fatigued most of the time, in the form of respiratory drive, in the form of neurological, in the form of increased heart rate. But above 50%, this is the dangerous level. Above 50%, he is going to have seizures, coma, dysrhythmia, ischemia, and tachypnea, and metabolic acidosis. Metabolic acidosis is important presentation of this methemoglobinemia. And above 70%, there is going to be fatal consequences. So there is severe hypoxia above 70%. So what is the treatment of methemoglobinemia? You have to give the cimetidine. Cimetidine is given 400 milligram 3 times a day. How it works, it basically inhibits your cytochrome P450 system. So it inhibits the metabolism of your dapsone, because it is cytochrome P450 dependent. But the worst thing is that with the passage of time, or with the increasing doses, there is going to be induction of the cytochrome P450 enzyme by other mechanisms, and dapsone that was working initially is not going to work now. So, and other drugs that are basically scavengers of this methemoglobinemia, are used in the treatment of methemoglobinemia, are vitamin E and vitamin C, which is ascorbic acid, and lipoic acid is also an important supplementation treat that can be used as adjunct to the cimetidine. So this is an important information about the methemoglobinemia. Then we had the side effect agranulocytosis. So agranulocytosis, it is important to know how agranulocytosis present. If you have started the patient on dapsone, and the first 3 weeks to 3 months, the patient is presenting with your fever, sore throat, and infection, just you should be vigilant that these are the symptoms of your methemoglobinemia. You should counsel the patient beforehand that these can be the side effects of the drug, and it needs immediate withdrawal of the drug. Despite the immediate withdrawal of the drug, there is going to be 7 to 14 days delay for the symptoms to be recovered, or the symptoms to be reversed. Next important side effect is peripheral neuropathy. For peripheral neuropathy, it is going to be motor rather than sensory, in the form of foot drop, in the form of glove and stocking sensation, and wasting of the small hand muscle. So it is an important side effect of dapsone as well. In the ocular side effect, there is going to be optic neuritis, optic atrophy, macular infarction, and in the form of dapsone, yeah, this is very important, dapsone hypersensitivity syndrome. Many a times this is the viva question, what is the dapsone hypersensitivity syndrome? So basically, dapsone hypersensitivity syndrome is commenced within the first month of starting dapsone, within a 3 to 5 weeks of commencing dapsone, and it has 4 cardinal features. If your patient meet the criteria of 2 out of 4, it's going to be labeled as dapsone hypersensitivity syndrome. What are the 4 features of this? There is going to be fever, there is going to be lymphadenopathy, generalized rash, and hepatitis. Fever is overlapping between the agranulocytosis and the dapsone hypersensitivity syndrome both. So in the form of agranulocytosis, you are following some focus of fever. There is going to be sign of infection or sore throat. But in the dapsone hypersensitivity syndrome, there is going to be fever along with lymphadenopathy and the skin manifestation like generalized rash and hepatitis. It resembles the DRESS syndrome, that is drug hypersensitivity eosinophil symptoms. So it is important to remember this as well. And the cause of death is liver failure. In this, most of the time you are going to find the nausea, vomiting in these patients, eosinophilia, leukocytosis, and immediate withdrawal of the drug is the right answer here. And but the important thing about the Dapsone is that drug can be reintroduced with the caution, so this is important. Other side effect, you already know that it can be hepatitis, hypoalbuminemia, GI upset, erythema, exfoliative dermatitis we have discussed earlier. Contraindication is Dapsone is definitely to be it's G6PD dependent. So the patients who are severe G6PD deficient rarely need Dapsone. You should be contraindicated about the Dapsone in these patients. And the caution is that Dapsone crosses the placenta, and its level are raised in the breastfeeding infants. So folic acid is administered for the mother who are going to receive the Dapsone in the pregnancy. So, and definitely the renal and cardiac and pulmonary manifestations who are severe renal failure or the patients of pulmonary disease, Dapsone should not be used in these patients. Among the drug-drug interaction, you know that the Dapsone is the metabolism of Dapsone depend upon the cytochrome P450 enzyme. So all the drugs that are inhibitors of the cytochrome P450 drugs is going to decrease the metabolism of the Dapsone. So it is going to be reduce the plasma concentration of the Dapsone by the by the inducers of the enzyme, and by the inhibitors of the enzyme this is going to be decrease the concentration. So rifampicin, carbamazepine, phenytoin, grazophobin, proton pump inhibitor, calcium, and H2 antihistamine, these are basically the drugs that are going to be reduce the concentration of Dapsone in the plasma. And the drugs that are very important in the inflammatory disorders, like immunosuppressive drug in the form of HCQ and methotrexate and sulfonamide trimethoprim, these increase the hematological effect of the Dapsone. Why? Because these are all drugs that are producing myelotoxicity or the pancytopenia. So these drugs are just copying up with Dapsone to produce some more destruction in the body. But at the pre-treatment screening, just remember the side effects and just put that side effects into the pre-treatment screening. It affects the liver, so you have to see the liver function, you have to see the renal function, you have to do the all neurological examination of the body, and you have to see the cardiopulmonary status, because it was producing peripheral neuropathy. So neurological examination is very important before starting Dapsone in any patient, specifically the motor examination and sensory examination of the body. How you're going to monitor and what is the dose, you have to start the Dapsone in a single dose or either 50 to 100 milligram, and it can be increased to the maximum of 100 to 200 milligrams. So just remember to dual, we have just think all the D's together in the Dapsone, that diamino diphenyl sulfone, and the DH is the FDA approved indication, and dual dose 50 to 100 milligram, and the maximum is the dual, like 200 milligram is the maximum dose, and 2 metabolism, acetylation, hydroxylation. So these are all the these are some clues of the puzzle solving. What is the monitoring of the Dapsone? Just remember this line: in the first month, one weekly; in the next 2 months, every 2 weeks. So just this is the focus, that your FBC with differential WBC for the first 3 months you should be vigilant, because there is going to be agranulocytosis increased risk in the first 3 months. So FBC with WBC count: first month one weekly, next 2 months every 2 weeks. This was the WBC. But for the retic count you have to do every 3 to 4 weeks, every 3 to 4 months, sorry. And in the case of renal and liver function, again every 3 to 4 months. But in the first 3 months you should be vigilant that liver and function tests are used every 2 weeks fortnightly. So these are all about the Dapsone, and fortnightly means every 2 weeks. So this was all about Dapsone, and another important thing is that G6PD interpretation. You should be able to know about the G6PD interpretation. What is the normal levels, what is the moderate deficiency, and what is the severe deficiency? Because the persons with a severe deficiency, you should not give Dapsone at all. Severe deficiency means that the patient has less than 10% of the normal range of G6PD in their blood. So, and if the patient is going to have less than 10% of the normal activity, that is labeled as severe deficiency, and this is the absolute contraindication for the Dapsone. So this was all about the Dapsone.